Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Radiofrequency ablation. Introduction. Your doctor may have referred you to a specialist to treat your pain with radiofrequency ablation. This procedure uses needles inserted through the skin to deliver heat generated by radio waves to stop the nerves causing pain from sending pain signals to the brain. This program explains radiofrequency ablation, rhizotomy, also known as radiofrequency neurotomy. It discusses when this procedure is recommended, its alternative treatments, how to prepare for it, how it is done, its risks, and what to expect after it. Pain. Muscles and other parts of the body send signals to the spinal cord through sensory nerves. The sensory nerves then go to some of the spinal cord and from there to the brain, where the brain interprets the sensation as pain. The aim of radiofrequency ablation is to block the pain in the nerves before they reach the spinal cord. Doctors recommend radiofrequency ablation to treat chronic pain in the back, neck, hip, sacrum, or knee. This program focuses on the back and neck. However, similar procedures are performed to treat hip and knee pain with radiofrequency ablation. The goal is to reduce chronic back, neck, hip, sacrum, or knee pain that hasn't improved with medications or physical therapy, or when surgery is not an option. Treatment options. A chronic pain is pain that is ongoing or keeps recurring after it has been treated. Healthcare providers first recommend rest and specific exercises to prevent pain. If this doesn't help, they can prescribe medications or physical therapy. If the pain persists for over 6 months, it becomes chronic and more invasive treatments, such as surgery and radiofrequency ablations, are recommended. Radiofrequency ablation is an outpatient procedure, which means you will go home after the procedure. It is often successful and safer than open surgery. In addition, many patients are not candidates for surgery, making radiofrequency ablation a good option for them. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Radiofrequency ablation. A doctor who specializes in pain management performs the radiofrequency ablation. The doctor will examine you and review your lab and test results to determine if you can have radiofrequency ablation. The pain specialist may do a test to decide if radiofrequency ablation will help you. A numbing medication is injected into a spot where the nerve bundles causing pain are suspected to be. If your pain decreases or disappears, then radiofrequency treatment may help you. Radiofrequency ablation is often successful. However, not all patients who have it will experience the same results. For some, the pain relief lasts for years. For many, the relief lasts from 6 to 12 months, and some patients may not notice a reduction in pain. Before the procedure, tell your doctor about all the medications and supplements you take. Mention any blood-thinning medications you are taking, as you may need to stop them before the procedure. Depending on what blood-thinning medication you are taking, you may need to stop them for several days before the procedure. You should not eat or drink for 6 hours before the procedure. Ask your healthcare team how long you should stop eating and when you can take your medication. Your healthcare provider may ask you to swallow your important medications at least 2 hours before the procedure. Ask somebody to drive you home. You should not drink alcohol for 48 hours before the procedure, as alcohol may create complications. Smoking on the day of the procedure can increase the chance of a blood clot that can be fatal. Do not use any tobacco product on the day of your procedure. Procedure. You will lie on an X-ray table. The doctor will give you oral medication to relax your muscles, then numb your skin with a local anesthetic, so you won't feel the pain, but you will be able to respond to your doctor. The doctor will then insert a thin needle into the skin all the way to the area of the nerve endings to be ablated. The X-ray will help the doctor guide the needle to the nerve. Inside the needle is a microelectrode that can send heat waves. The doctor will ask you if you feel a tingling sensation. This will help confirm the right area for treatment. The doctor will then send a small current through the electrode to heat the nerve tissue and block their ability to send signals to the brain. The procedure takes 15 minutes to a half an hour, depending on which nerve your doctor will treat. You will go home after the procedure. Risks. This procedure is very safe. There are, however, risks that are rare. You need to know about them just in case they happen. By being informed, you may detect complications early. Like any other invasive procedure or surgery, there is always a risk of bleeding or infection. Some decreased sensation or numbness are normal for some ablated nerves. Ask your doctor if you should expect any decreased sensation from your ablated nerve. It is possible to develop some weakness after this procedure. However, this is not common. The areas affected depend on which nerve is ablated. After you go home, tell your healthcare provider about any weakness you develop. It is possible to develop an allergic reaction to the anesthetic. Tell your doctor of any allergies you have before you have the procedure. There is always the possibility that the procedure may not help the pain. After the procedure, the symptoms may worsen before improving. This is normal. If the injection site is painful, use a covered ice pack and not a heating pad. Place the covered pack on the sore area for 20 minutes. Repeat 3 or 4 times per day. You may take a warm shower 24 hours after the procedure. However, don't take a bath or swim for 2 days after the procedure. Call your doctor if you notice any signs of infection. These include fever of 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, severe pain at the injection site, blistering at the injection site. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. In radiofrequency ablation, your doctor inserts a needle through the skin to deliver heat generated by radio waves to stop the nerves causing pain from sending pain signals to the brain. Doctors recommend radiofrequency ablation to treat chronic pain in the back, neck, hip, or knee. Radiofrequency ablation is an outpatient procedure, which means you will go home after the procedure. This procedure is very safe. There are rare risks, which include bleeding, infection, damage to the nerve, and weakness sensations. Radiofrequency ablation is often successful and safer than open surgery. However, not all patients who have it will experience the same results. For some, the pain relief lasts for years. For many, the relief lasts from 6 to 12 months, and some patients may not notice a reduction in pain. Thank you for using Explain.